Let's see if I can get through these today. I got two medicines. I may have overdid it. Tomorrow's one medicine, Kelly Arsenicum iodatum, which is a good allergy remedy, good for this time of the year too. Recently did Arsenicum album, so today is Arsenicum Bromatum and Arsenicum Hydrogenisatum. Genisatum. Arsenic is, and it's, well, I'll get into that. Okay, so let's start with a bromatum. Then I'm going to go into some case taking, which is really the important part because, if you don't take the case right, you miss the whole ball game. You end up out in left field picking remedies, doing things, just like my mother, having this flu. And I can't, I did spend some time and sat there and listened to her, but I can't ask, and I'd ask her some questions. Does it burn? Does it feel this? Does it feel that? But, she doesn't believe in what I do. you know, she'd rather me go be a janitor, go work, like I did before. But, anyways, so I'm guessing, and basically educated guess, so I gave her both two. She had tiredness and she had lung issues and a flushed face and looked like a fever. Her face was real flushed. So that's belladonna, gelsemium. So I gave her gelsemium first and then on a Sunday. And she wasn't getting out of bed for 2 days at that point. Yeah, 2 days not eating, not getting out of bed. She was drinking, so I was able to get something into her. So I had my niece help me, and she went and got the water. Said, "I'm going to get you more ice, Graham," and she brought it out, and we put in gelsemium. And then I went away, and I'm thinking, why not just give her belladonna too, just in case one of them should work. So I had her get the water again, and we gave her belladonna. So that's two medicines I gave her. The next day on a Monday, she got up, she ate, she's still going to bed. Now I basically, that's why my mentor Robin says, give one medicine. Then you know what's working and you can keep giving that medicine. But I can't go back and say, is that medicine working? Because I can't even let her know I gave her one. So after that, I thought, you know what? There's a sudden onset, this and that. I gave her another medicine, or aconite. So she's up out of bed. She's eating now, but she goes to the doctor today. You know what they're going to give her? Antibiotics, which is fine. Get rid of it. But if I'm able to sit down with her and talk to her and take a case, it makes it so much easier. So bromatum, tincture and all potencies. I'm surprised that arsenicum bromide of arsenic, is able to be given in a tincture form. And that's this one really I don't think has been proven much. That's why it's such a small remedy, but it's got some important points. So I'm just going to basically read from it. Arsenicum bromatum, acne rosacea with violet papules. So acne with papules, they'll have a pus coming out on nose. Worse spring, acne in young people, diabetes, mellitus, obstinate syphilis, good syphilis remedy, anti-syphilitic, and an anti-psoric. Anti-psoric is skin stuff. Anti-syphilitic is, of course, syphilis miasm or the syphilis disease. Arsenicum bryorum has proven a great anti-psoric, anti-syphilitic remedy. Hansen says it is useful for acne rosacea with violet papules on the nose, diabetes mellitus. Okay, Arsenicum bryorum has herpetic eruptions, syphilitic excretions, glandular tumors, and indurations. So they're hardening tumors. Carcinosa, good for cancer. Locomotor ataxia, they can't, their movements they're not able to move as good as they should. Obstinate intermittent fevers, acne rosacea with violet pupils on the nose. Okay. Acne in young people, diabetes. Okay, let's see. Anschutz, homeopath, best successes were in obstinate cases of syphilis. In the first stage of tabes dorsalis, in the reconvalescence. So the disease comes back from exhausting acute diseases. So any disease that keeps coming back and they can't get over it, arsenicum bromatum. Also in, like I said, syphilis and cancer stuff. Disease of the of gastric suppurations, inactivity of bowels, tardy digestion, and constipation. So they're having a lot of digestion problems, elimination problems down there. In those cases where China salt failed, in intermittent fever. So you're giving China salt, and it's not working, man, but it's indicated. So China sulfa is very close to Arsenicum bromatum. He prescribes Arsenicum bromatum twice daily, 4 drops each time in a full glass of water, gradually diminishing it to 1 daily dose, and in 4 weeks, even the most obstinate cases yielded to this treatment. And that is in intermittent fevers. It could be cholera, it could be, whatever, flus, whatever it is. But that intermittent fever, chill, fever, chill. This Arsenicum bromatum helped. The patient feels encouraged by his increased vigor. The fever cakes disappear. Cakes, I'm not going to look at them. The bowels more regularly, and appetite leaves nothing to be desired. So they start going to the bathroom, they start eating more. Those mean obstinate cases of intermittent fevers, often appearing in the form of unbearable neuralgias, yield more rapidly to it than the quinine. So they were given, in these intermittent fevers and cholera, they were given mercury in the dose, and basically poisoning people. I don't know, probably lower doses, but eventually, from that mercury, your gums become soft, all kinds of stuff. ST, age 46 years old, contracted syphilis some years ago and was relieved by it by mercurial treatment. So that's the mercury they were given for the syphilis. And by Zittman's decoction. Probably had mercury in it, but about 6 years ago, he felt out of sorts, and a papular eruption appeared on the forehead, temples, and especially on the root of the nose. Though treatment was immediately instituted, still in a few weeks the face of the patient was covered by ugly, foul-smelling crusts. And that's that papules. They got them crusts and they're popping, and so it's kind of bad. Cod liver oil was taken internally and applied externally until the scurfs fell off and the eruption concentrated on 3 points. The 6 months the treatment was kept up, but after being omitted for a few weeks, the eruption spread again. It is to its former extent. Every treatment was tried in rotation without the least benefit. So these topical things and different situations. Now, there was a kid in our area. He had cancer of his leg, so they irradiated him, did this and did that and did the other, and it went away, but it popped out again. You know why? Because the body's trying to push something out. So they cut his leg off. Now he walks with one of them things. And just like that lady's toe from septicemia, that would be so easy for a homeopath to take care of. The proper medicine, when you hit the right medicine, it clears everything up. In the spring of 1856, he entered my clinic. In the center of the forehead, at the root of the nose, on both eyebrows, and on the temples and the right cheek, there were moist hepatic eruptions covered with crusts exuding on least pressure. So you push on them and pus comes out. An acrid burning discharge with easily bleeding. So it bled and it pus, and it was acrid burning like. Around these eruptions, the skin is injected, reddening, interpreted with a large network of veins. Cough and expectoration hint to a beginning of tuberculosis. So from this skin thing, he's realizing this person's starting to get tuberculosis. And an heirloom in the family, little appetite. An heirloom in the family. Oh, the family must have had tuberculosis within the family. Just like my mom, I got lung issues, and now every year so far this year. Now that's a periodicity. Every, I don't want to say autumn, but summer, late summer, she got this same cold last year. Couldn't go to the family picnic, which we never saw our family much. They live out of town, so that was a shame. So, and now I can look up something that says lung issues every summer. There's probably a medicine that has that. Little appetite disturbed, digestion, tardy defecation, and evening fever. He is ordered solution or so twice a day, glass of water. Oh, Arsenicum Bryoneum. Okay, he's ordered that twice a day. And already in 2 weeks, the eruptions begin to dry up. It returns to the bowels and are regular. After 2 months, two crusts fall off, and the skin under them is soft, shining, somewhat red. About the eruptions had gone and greatly improved. Arsenicum Bryoneum is also a powerful remedy in diabetes mellitus. So the skin thing, I used to, I was taking singing lessons with the lady. She was a pretty girl, but she had all these pimples on her face, and boy, I just wish it. How do you approach her and say, hey, I can help you with that? I don't know. I'd love to give her something and see that clear up for her. Arsenicum Bryomeum is also, it would change her life. That's the whole thing. I don't know what she's doing now. She's putting things on it, whatever she's doing, but that would change her life. Her face, she's a pretty girl, blonde-haired girl, and once that would clear up, I guarantee it would change her life. Arsenicum Bryoneum Bromatum is also a powerful remedy in diabetes mellitus and insipidus. Cured cases where the patient had already reduced from 138 to 98 pounds. The urine was condensed. Let's see, a diabetic patient needs fresh, pure air if he wishes to get well. Confinement in a room is office. Okay, treatment is ozone. Okay, let the patient take 3 drops thrice daily in a glass of water, and after a week, the insatiable burning thirst will be quenched. So diabetics have a lot of unquenchable thirst. And these doses must be continued until the quantity of sugar in the urine reduced. So this is going to, basically what it's doing is getting that thyroid moving again and reducing the sugar and eliminating it, when the remedy might be taken twice a day and continued for a long time. So they could continue that. So diabetes or acne, any kind of syphilitic eruption, syphilis, if they get syphilis, anti uh, syphilitic and antisoric skin stuff and syphilitic stuff. So Arsenicum hydrogenisatum, which is arseniuretted hydrogen. So hydrogen with arsenicum in it, basically. Arsenicum hydrogen. Okay, yeah, I got that. Hematuria, which is blood in the urine. Sudden suppressed menses cured after Arsenicum album failed. So if Arsenicum album fails, you're giving it, it seems like it's sad, you might want to go to Arsenicum Hydrogenisatum. Urine suppressed, they're not urinating, followed by vomiting. Violent vertigo, going upstairs. Violent sneezing. Nose nose is cold, so the nose would be cold. Tongue enlarged, deep irregular ulcers, mouth little thirst. So they don't have much thirst. So let's see what this one is. Trituration and all potency. So Arsenicum hydrogen. Well, I'm just going to shorten it. Arsenicum hydrogen was used by Drysdale as a substitute for arsenic in the collapse stage of cholera. So any cholera situations, Arsenicum hydrogen was used. The symptoms set in suddenly but developed slowly. In poisoning cases, so when someone was poisoned with this stuff, death often took place in the second week, and one person who recovered suffered 7 weeks from being poisoned from this stuff. Though like arsenicum in general symptoms the symptoms of so it's in a gas form of its own. A striking case of sudden suppression of menses was cured with it after failure of Arsenicum album. So when that's why I say when you have one remedy failing, but it seems like it's that remedy, you might want to look at the ones that are closely related to it. Arsenicum hydrogen has the general action of arsenic album, but more which I did Arsenicum album 2 days ago, but more accentuated anemia, anxiety, despair, hematuria, which is blood in the urine? Yeah, blood in the urine, with general blood disorganization, so the blood's all messed up, hemorrhages from mucous membranes, so they'll bleed from not only the urine but different membranes. Urine suppressed, followed by vomiting. The prepuce and glands of the penis are covered with pustules and round superficial ulcers. There's collapse from cholera. or any flu or anything, there's a collapse, coldness, prostration, sudden weakness, and nausea. Skin becomes dark brown. So the head has violent vertigo on going upstairs, eyes sunken, broad blue circles around, violent sneezing, nose cold, must be wrapped up with warm cloths. So there's that nose is cold when you feel the nose, violent sneezing, blue circles around the eyes. So when you look at this person, you'll start considering this medicine. Tongue enlarged, deep irregular ulcers, nodules, swelling, mouth hot and dry with little thirst. All right, so tongue enlarged, deep irregular ulcers, mouth with little thirst, nose is cold, cholera situations, blood coming out of different areas. This one will be considered when Arsenicum album fails, Arsenicum Hydrogenisatum. So that's why homeopathic medicine can be rough. You know, you have a lot of different medicines, just like I was trying to figure out with my mother without asking questions, too many questions, to let her know that I'm giving her medicine. And this, I could have gave her one medicine, because I'm telling you, with that cough, I was thinking antimonium tarp. I wish I could have asked her more questions, said this medicine's this medicine's that, but I can't do that. So I had to take guesses. And the one guess, I may have hit it perfect with gelsemium. Gelsemium has that flushness too, hoarseness, so I went under hoarseness, and that's the main symptom I went under, hoarseness, and then I looked at the lung stuff. So yeah, I mean, you have to sit, and as I'm going to go over now, you have to hit the center of the case. If you don't, and you're hitting, like I said, if I go for hoarseness, and that's not the main symptom, but it's the cough, that's the main symptom. So I went under, that's what I did. I went under cough, went under hoarseness, had a bunch of different remedies, and then I started looking at them and saying, okay, what's going on here with, I asked her, I finally got out of her what color her mucus is, which I'm surprised she told me. She said white, so yeah, if it was green or something, that would have helped a little more. But anyways, uh, I got her out of bed. You know, she no longer was laying in bed, and she started eating. And I guarantee you, one of them medicines I gave most likely was working. And if I could, and I wasn't even ponding it. Usually, I put it into that bottle of water and I pond it and give it to them. This, I just dropped it in and let her drink it. So didn't really get to succuss it and get all the molecules of the water. But I guarantee you, it had the dose of medicine in there. So after being in bed for 2 days, the third day, she was now got up, ate, and she didn't spend time with us on that Sunday. No, Sunday's when I gave it to her. That's right. Monday, she was out of bed eating. She didn't eat dinner with us. She wasn't eating. And she was just laying in bed. So, and coughing and hoarse. And now she's taking cough medicine, so I can't tell whether, things are working in that sense either. Because you take a cough, it suppresses the cough. You don't want to suppress the cough. That's the wrong way to go. You want to give something that'll cause the cough more, to push out whatever sickness they got and clear it up. So suppressing the cough, I'm working through a suppressant. I'm working through, a person that doesn't believe and is like not going to give me symptoms. So yeah, it can be rough trying to do that. But if you have a person that's, really becomes open, you can hit them, but you don't really need it. If I was able to pick the right medicine, get it and pound that bottle and give it to her, like I'm almost positive gelsemium should have worked, but I threw belladonna in just as a safety valve, see if which one was really the one. All right, so clinical topics now. You can label the sickness, you can go by the rubric, you can do the disease name, the etiology, or when it happened, what brought this on. The rubric is the sickness, the cough or the sore throat or the whatever. You are looking for differentials. So you're looking for things that would separate the medicines apart. And we'll get the differentials in a minute. This gets you into a group of remedies before you repertorize. And when I say repertorize, that's this book, which has, this is generals. So, generals is just like, what would I say? You could have sensations under generals. And sensations is always a good one to differentiate between stuff. So under generals is sensations. Let's see, let's go to another one. Feet, swelling. I go to feet, swelling, so these are the rubrics and these are the things that you're looking at. And before you repertorize, because you can get in there and get real lost, before you repertorize, you've got to take the case and you've got to figure out what the center of that case is. Whether it's the etiology, the rubric, you get a flu. Oh, I got the flu. But what does that mean? That could be the flu can be have different affect people in different ways. So that's when you go back to the rubric. What kind of cough do they have? When did this start? What brought it on? Cold, wet, damp weather, or stress, or gastric stuff. You figure out what brought it on. That's the etiology. What happened that brought this on? A grief. They had a grief. That can help you to determine between medicines. So you get into a group of remedies before you even repertorize, and that's by figuring out what the center of this case is. Is it the throat? Is it the stomach? Is it the headache? What is it? Then you go with keynotes. Keynotes, strong symptoms, etiologies, and constructed layers. Now, a layer is they had a grief, that sets down a layer. Then a few years later, they have a car accident, that sets down a layer. Then a few years later, they have a flu or something. So now you're going to most likely peel off the last one, like the flu. You'll peel that off, and underneath will be the accident. Then you can peel that accident off. Use an arnica or nat sulf or something. Then you go back and they have a grief. They lost somebody. You can peel that off. Use an ignatia or some sort of remedy. So you're in the key. So that's the layers. The etiologies are the things that happen. The grief at that time, and you do a timeline. When did that grief happen? Then when did the accident happen? Then when was this flu that you were never well since? Those are etiologies. When these things happen, these different things to the person. That sets down the layers. And like he said, it puts a tear in the vital force that you have an energy leak, or you can have a congestion where things get stopped up. Strong symptoms. What are the strongest symptoms and the keynotes? Keynotes are Bryonia and Rhus tox is the best ones. Rhus tox better by motion. Bryonia is worse by motion. So if you're stuck between those two, you use the keynote to figure out, to eliminate one and go with the other. This brings you from thousands of remedies, which is what we have, to 20. Now you have to differentiate between them. And that, like I said, the differentiation is, what do they like? Cold water? Do they like warm water? Do they like rest? Are they better by rest? Are they worse by rest? Better by motion? Are they restless? Or are they just comatose? These are different things that you differentiate. When you differentiate, the symptoms have to be in context, or you'll miss the whole thing. So in context is let me see. So I got a knee injury. Oh, okay. So, it could be arthritic. Let's get in here. I know you don't need to see my face. It could be arthritic. It could be from an accident. If you get off to an accident, oh, you have knee pain. Oh, it's from an accident, and you're going down the accident road with that, no pun intended, then you get off track when it's an arthritic situation, or they've got gout or something that's affecting it, or they had surgery on it. So you need to know what the context is. Did something happen that brought this on? So anyways, uh, so let's take a flu remedy. Will cure a lot of flu symptoms, but not always cure the flu. So what's that mean? That means, you've got somebody that has the flu. They're coughing, they got a fever, they're tired, and all this stuff. And you can, tiredness, you can hit them with gelsemium. They got a cough, you could hit them with bryonia. You could, they've got a fever, you could hit them with belladonna. So all these medicines could be. So you need to find out what the symptoms are, where this came from. First off, where this came from, this flu, what happened? Okay, then you got to find out which symptom is the worst symptom, or which symptom is the um, center of the case. Is it the throat? What would you like to cure first? That's all what I always say. If I got rid of one thing, what would it be that would make you feel better? If they said my throat, it's just so sore, or like that guy, Indian homeopath with the cancer in the ear, he said, oh, my stomach. And then, so the stomach is the center of the case. Why the stomach? You got cancer on your ear, dude. I don't get it. Then you go to the etiology. What happened? What's going on? Oh, someone's trying to take my land and it's just aggravating me, and the body's got to get this aggravation, and cancer comes out in the ear, or a flu comes out, or skin issues come out. So that's what you're trying to figure out. Why do they have this? I have a headache constantly. Oh, every time I eat this I get a headache, or whatever the gastric situation is, now you got a gastric headache going on. So these are the things that you're trying to figure out. Where's it coming from? And it can be so simple with keynotes, with etiologies. When did this start? What happened? Oh, huh. So you had a car accident. Now you have knee pain. Constant knee pain. So now you're going for arnica, or some kind of rust tox. It could be any kind of remedy that's for an accident that the knee has a problem. Or if they say nothing, I just have a knee problem. So you're going for an arthritic, a rheumatism knee remedy. So otherwise, you hit it, and like my mom, I may have just palliated with some of those medicines I gave her. Not being able to ask her the proper questions to say what's going on, just to sit and observe. And that's what we're to do anyways, because, we just observe things. And when we start putting our judgment on it, then we get out in the left field, and it throws us off. So just sitting there observing her, listening to her cough. So I went, and I even looked under croup, because it sounded like it wasn't quite barking. And I looked under bronchitis. You look under, and a lot of these different rubrics that you'll have in here, in the repertory, the different rubrics that you'll have will be bronchitis. And bronchitis will have the same stuff as croup, a lot of similar remedies, a few different, so, now if they go get a diagnosis and you got a name, it could help, but not always, it could throw you off too. So we have a headache. A migraine, is it tension? Is it reflex headache? What is it? Could be a misalignment of the neck. Uterus prolapse could do it. It could be a gastric headache. This is the context. So where is it coming from? And that all comes down to, thank God I took health coaching, because that gave me the ability to ask the proper questions, the leading questions. That helped in that area. Everything I take and do seems to come in handy for me. But so the proper questions will lead them to finding out, is it, oh, I have a prolapsed uterus, and it could be a misalignment in the neck, do you have, there's tension up there in the neck, and I get these headaches, This is the context. Like my wife's headache, and I consider it's from her smoking, she gets these powerful headaches, smoking and stress, mainly stress. And then the smoking doesn't help. So anyways, if symptoms is strong, clear, or the etiology is strong and clear, whichever one it is, whichever one is stronger, clearer, prescribe on it. So, if you have, I got a headache. What kind of headache? It just aches. Well, that's pretty bland. Is it throbbing, pounding, stabbing, stinging? It just aches. And that's all I kept getting from my wife for her legs. They just ache. Is it a burning there? Is there a stabbing, a stinging? What's it feel like? It just aches, and it's better by pressure. For a moment, when I would push on it, it would get better by pressure. So, whatever's the clearest symptom, or the clearest cause of these symptoms, you want to prescribe on it. All right, symptoms individually don't have meaning. They need to be in context. There was an injury, there was a flu, there was a grief, etc. So you have to get all these symptoms in context with what's going on. Like that lady in Germany, she said, I just don't want to go out. Okay, I thought of a remedy for that. And then she said, well, I can go out to the doctors, but I can't go out to go shopping. I can't take care of stuff. I don't want to make a list and get the stuff and bring it back. And so I have to really work myself up to go do it, And I said, well, what, so I got, later on, the etiology was she was a single parent taking care of her family, working 14 hours a day, all that trauma and stress. Now she doesn't want to do it. So kelp carb, and there was a couple other ones that were in there, and I showed her, and yeah, kelp carb sounds like me. Got her 30% better. So we can do symptoms, but it's a lot of work and can take you down the wrong road without the context. So you got to get that context. And I got that context. She had a stressful situation in I don't know how many years growing up her kid, 20 years, I don't know. But in working all them hours, and now she doesn't want to do any, she doesn't want to be responsible, basically. Kelp carb helped that. The real key is to perceive the case. Get a picture or an image of the case, the whole picture of it, from the etiologies, plus the symptoms, plus the totality of what happened to them in their life. You get a clear picture. Now you start with the top layer and you start peeling it off, um, you know, and then you'll see another picture pop up from the last thing that happened to them. And you can keep peeling that off until you get down. But you need the context. You need the whole case to look at and say, what has happened to you? What has gone wrong with you? What makes you feel better? Everything. That's why we take a whole case. Because then when we go and take care of one layer, then we can go in and say, oh yeah, this is perfect. That layer's gone. Now you're into this layer. And I see these symptoms now. Now we go to the next layer. So all right, I'm over time by a minute, and that is morning medicine. You can age, but you don't have to get old. Arsenicum bromatum and Arsenicum hydrogenisatum or something like that.